In Kenya, dozens of medical workers have died from COVID-19. Their deaths have left the relatives reeling from the loss. CGTN's Enock Sikolia tracked down a Kenyan family that lost their son who worked as a periodontal surgeon. Let's take a look.
It is really paining. I never knew death could pain until you feel you are no more.
On the 30th of November, Dr. Hudson Alumera was laid to rest in his rural village in Western Kenya. The dental surgeon died of COVID-19.
That's the time I felt COVID was real, and COVID is really with us, and it can kill anybody at any time.
Lying in an ICU bed last month, Dr. Alumera understood what was happening to him. Alumera had been a dentist at the Kenyatta National Hospital, where he also trained future dentists from the University of Nairobi. Within days of his last shift as a doctor, Alumera became a patient. Aged 37 years old, Dr. Alumera was alone in the intensive care unit, less than 20 miles from his wife and a 7-year-old son. No one was allowed into his ICU room, save for his doctors, nurses, and cleaners.
And he told me, just continue praying. My right lungs are damaged, but don't tell Mama Lee, please. Promise that you'll not tell Mama Lee that my lungs are damaged. That was the last message.
As he grew sicker, messages to his family became less frequent. In his last phone conversation with his mother, Dr. Alumera promised to be back, a promise he could not keep as he lost his battle against the virus.
I cannot remember what I did next. I only found people just full in my home. I don't know whether I removed my clothes. I was only shouting, my daktari, Hudson, you have deceived me. Hudson, you never told me the truth that you are going away.
Frontline healthcare workers face a high risk of contracting the coronavirus, and a number of them have become sick. Dr. Phoebe Juma has been on the front line of fighting COVID-19 since Kenya reported its first case. While battling the pandemic, she became a victim too. And after recovering, Dr. Juma is now helping even more of those fighting COVID-19.
You can't afford to give up. Yeah, who will be left to take up that burden?
The Africa CDC is urging African governments to shield doctors and nurses.
The number of health workers we have are few. It means we need to protect them very well.
His death meant that Kenya and the medical fraternity had lost a great doctor. But for his family, no value can ever be placed on his death. That is because he was a father and a breadwinner, not just for his immediate family, but for his siblings as well.
When I heard that nobody will be allowed to see even the body, it pained more. I could not accept the reality. How do I bury somebody that I have not seen?
Enock Sikolia, CGTN, Nairobi, Kenya.